In the continuation of our last topic, shock, in this lecture, we are going to discuss the hypovolemic shock. There are four classes of hypovolemic shock. We have class 1, class 2, class 3, class 4. And there are various parameters which we need to discuss in classes of hypovolemic shock. The most important parameters is amount of blood loss, and the other parameters which we need to discuss are pulse rate, systolic blood pressure, diastolic blood pressure, pulse pressure, respiratory rate, urine output, mental status, and the last is base deficit. These are the various parameters which we need to discuss in all four classes of hypovolemic shock. Now, the first thing which we need to discuss is what is the percentage of blood volume loss in each class of hypovolemic shock. In the classes of hypovolemic shock, it's very easy to remember 0 to 15%, that is class 1, 15 to 30%, that is class 2, 30 to 40%, that is class 3, and more than 40%, that is class 4. Again, the amount of blood loss, which is approximately 400 to 500 cc lost in class 1, and you just keep on adding 500 to each class. So this is going to be 1 liter in class 2, 1.5 liter in class 3, and this is 2 or more than 2 liter in class 4, right? Now we will discuss about class 1 hypovolemic shock. See, a patient who has lost around 400 to 500 cc of blood. I am sure a lot of you must have donated blood. If you donate blood, we donate approximately 450 to 500 cc of blood, right? Now, if you have given that much blood, you have experienced class 1 hypovolemia. And those who have donated blood, what happens to your parameters once you have donated blood? Every parameter remains normal, right? Nothing changes. Now, as we have donated blood, what do they give us after blood donation? We get a fruity and a packet of biscuit. So the management of class 1 hypovolemia is oral liquids. That is all you require. Okay. Next, we talk about class 2 hypovolemic shock. Class 2 hypovolemic shock is also known as the compensated phase of hypovolemic shock. This is very important. Now the question is why we are saying it is a compensated phase. Let's look at the physiology of class 2 shock. So if you look at the physiology of class 2 shock, when blood loss happens, the sympathetic system is stimulated, right? And when the sympathetic system is stimulated, adrenaline and noradrenaline are released from the system. Now, what is the first change which adrenaline and noradrenaline will bring about? The first change which adrenaline and noradrenaline will bring about is tachycardia or increase in pulse rate. And this is the earliest indicator of hypovolemia. Okay. Now, what else is ADR and NOR-ADR going to do? ADR and NOR-ADR are also going to cause peripheral vasoconstrictions. Now, when the peripheral vasoconstriction happens, the blood is not going to flow to the peripheries, and the peripheries are going to become cold. Now that when this vasoconstrict, what is going to happen to the peripheral vascular resistance? If you have a constricted vessel, there is more resistance to the flow of blood to the peripheries, right? Which is why blood is not going into the peripheries. So peripheral vasoconstrictions will give rise to increased peripheral vascular resistance. So a simple rule is any shock with cold extremities, the peripheral vascular resistance increases. And any shock with warm extremities, the peripheral vascular resistance is going to decrease. Okay. Now, why is the body causing peripheral vasoconstriction? The body is causing peripheral vasoconstriction because it wants that the blood should go to the vital organs like heart, brain, kidney. And because this shunts more blood to the vital organs, the cardiac output and the systolic blood pressure are going to remain normal. Because more blood is returning to heart, the cardiac output and the systolic blood pressure remains normal, which is why we are saying this is the compensated phase, that despite blood loss, the body has adjusted and there has been no loss in systolic blood pressure. Now we know that the pulse rate is increasing and this is the earliest indicator of hypovolemia. Here systolic blood pressure remains normal. What happens to the diastolic blood pressure? We have read in physiology that if the peripheral vascular resistance increases, then the diastolic blood pressure will also increases, right? So diastolic blood pressure increases. Now understand one thing, this is our systolic blood pressure, it remains normal. This is our diastolic blood pressure. Systolic blood pressure minus diastolic blood pressure is pulse pressure. Okay. So systolic blood pressure is not moving, but diastolic blood pressure is increasing. So the pulse pressure is going to be narrow. Okay. Respiratory is going to remain normal. Urine output remains normal or slightly reduced. The mental status, patient is going to be thirsty and anxious. Okay. And the base deficit is going to be -2 to -6 milliequivalents per liter. So some amount of acidosis has started happening now, right? And these patients are going to require IV crystalloids. We can use normal saline or ringer lactate here in form of crystalloids to manage the patient. Now, let's look at class 3 shock. This is the decompensated phase of hypovolemic shock. Now, what do you mean by decompensated phase? That now the body has lost so much of blood that now the systolic blood pressure cannot be maintained. So, systolic blood pressure will start to fall. Now, there will be further tachycardia. Tachycardia increases, right? You have a rapid 3D pulse. Systolic blood pressure falls for the first time in class 3 shock. Okay. The diastolic blood pressure also falls because there is loss of circulatory volume. So although there is vasoconstrictions, peripheral vascular resistance is increasing, but now so much of blood is lost that now diastolic blood pressure will also fall. So the pulse pressure become even narrower because both systolic and diastolic blood pressures are falling. Respiratory rate is going to increase. Patient will have tachypnea. Urine output now starts to fall dramatically and patient is now confused. The base deficit is -6 to -10 milliequivalent per liter. Now these patients cannot be managed alone with crystalloids. Okay, so they have to be given IV crystalloid with colloids. Okay, in colloids we can give albumin, starch. There can be dextran and various types of colloids can be there. We can also give blood products. Okay, these are also colloids. So you will give crystalloids and colloids in ratio of 3:1. 3 part of crystalloids and 1 part of colloids. Okay. Now let's move on the last class, that is class 4 shock. So class 4 shock is very easy to remember. The patient has lost so much of blood that everything is non-recordable, right? The pulse is non-recordable, BP is non-recordable, and you can't record the pulse pressure. The respiratory rate increases even more. Patient has anuria, means there is no urine production. These patients will be in state of coma and the base deficit is more than -10 milliequivalent per liter. Now, in these patients with class 4 hypovolemic shock, what do? We have to give these patients a massive blood transfusion. So we have completed 4 classes of hypovolemic shock. Next, we are going to discuss about massive blood transfusion.